show this morning. The topic this morning is childhood obesity, and we're fortunate to have with us to talk about childhood obesity Dr. DSchlundt. Dr. Schlunt is from Vanderbilt University, and he is in the Department of Psychology. And of course, Dr. Schlunt, let me welcome you to the show this morning.
Thank you so much, Dr. Haney.
And to say, Dr. Schlunt, I think the first time that we had an opportunity to talk to you about weight control and diet and associated subjects was about in 1995. And of course, we remember that when we decided to deal with childhood obesity this morning. And so we want you to talk about, to give us the same kind of information dealing with childhood obesity that you and others gave us many, many years ago. But of course, it's a much more serious problem now in 2004 than it was in 1995. But nevertheless, Dr. Schlunt, before we get into childhood obesity, let's have you to give us some information about your background, your education, and some of the things that were important in terms of eventually leading you to Vanderbilt University to deal with this particular subject.
Okay. Well, I'm originally from Indiana. That makes me a Hoosier. And went to school at Indiana University, did some of my graduate work at University of Wisconsin, and then finished my PhD at Indiana University. My training is in clinical psychology, so I really specialized in helping people understand and change their behavior. I then went to Jackson, Mississippi for 4 years, where I was at the medical center there, and really that's where I began to work with eating and eating disorders, hypertension, and obesity. And that's where I really developed this interest in understanding why people eat what they eat, why it's so hard for people to make changes, why weight is such a struggle for so many people. I worked there for 4 years, involved in several research studies, and then felt very fortunate to be able to join the faculty at Vanderbilt in 1985. So not quite 20 years, but we'll be going on that soon since I've been here. And so Nashville is really now my home. And in Nashville here, I've continued my interest in health behavior, health promotion. The most recent things that I've really become involved with is the whole issue of health disparities. Why is it that rates of so many of the chronic diseases, whether it's heart disease or cancer or diabetes, why are these so much higher in low-income and minority communities? And as a psychologist, I approach it from the level of, well, there probably are some things in the way people are living, the choices that they are making, and what influences those choices that's contributing to these health disparities. I'm very fortunate to work with the Reach 2010 project, where we're trying to target heart disease and diabetes in North Nashville. I'm working with a study called the Southern Community Cohort Study, where we're going to study 100,000 people in the Southeast to try to understand what the risk factors are and why these disparities develop.
Very good. You know, I think, Dr. Schlunt, with that kind of information, I think this is one of the reasons that we thought in terms of identifying an individual who could really talk about diet and health control and obesity really from a different perspective and from a different point of view. And I'm sure that you'll be able to sort of give us that information. I think that childhood obesity is a real issue, and not only is it an issue here, but we also know that the state of Tennessee has taken up this whole idea. Let's have you to give some preliminary statements before the end of this first segment in reference to childhood obesity.
Okay, well, what we know is that the rates of overweight and obesity in children have been growing steadily for the last 20 years. And to the point where it's becoming alarming to the public health establishment. But in fact, you don't have to be a doctor or a psychologist or an epidemiologist to see it. If you go to the beach in the summer and look around you, you'll notice that compared to 25 years ago, the children are heavier. It's just become very, very noticeable. If you walk into a school, if you go to the playground. So it's a growing problem, and it's something that we really need to understand what's causing this, what can we do about it, and why should we be concerned? It's not just that fat kids look cute, it's that being overweight is putting their health at risk and possibly shortening their lifespan.
Very good, and of course we've got a few seconds before the end of this first segment, and when we come back we'll give you an opportunity to deal with the issue of why we have so many overweight children at this particular time. And of course, we'll be back with our audience immediately following this first commercial break. The guest is Dr. DSchlundt.